So welcome everybody. Thanks for coming. I'm Dr. Cliff Smyth. I teach in the Department of Mind-Body Medicine in the College of Integrative Medicine and Health Sciences at Saybrook University. So I invite you to make yourself comfortable in a way that your sitting feels supported. You might sit forward on the chair and feel your feet on the floor, your pelvis in the chair, and the sense of the spine rising up from the pelvis, long to support the head. Or if it's more comfortable, bring the back of your pelvis back to the back of the chair and find the support from the chair that way. But again, thinking of sitting tall and supported with the spine long so the head can balance on the spine. And now begin to track the movement of the breath without changing it particularly, just the rhythm, just inviting the breath to come and go. It might change a bit when you first attend to it, but after that, find out if it's possible for the breath to settle into its own rhythm. Noticing the full duration of the in-breath and of the out-breath, and any little pauses in between. Noticing as much as possible without breathing in any particular way. Breathing, especially without any judgment, any particular notion of how you should be breathing. Breathing happens. Just let it happen as much as possible. And if it's comfortable, you might bring your hands, the palms of your hands and the pillows of your fingers to your abdomen and shape them to the body there. And allow them to respond to the movements of the abdomen as you breathe in and out, without stopping the breath or amplifying the movement in any way. Just listening with your hands and with your whole self to the spontaneous coming and going of the breath and the movements that go with it. So this practice today is named the depth, and it involves using small movements of pressing one thumb into the palm of the other hand in synchrony with the breathing as a way of inducing pleasant, comfortable calming. It was developed as a kind of somatically based, guided natural breathing practice by the creator of the sound asleep system, Michael Krugman. So just bring your hands to rest in your lap with the palms facing up, and allow the weight of your hands and arms to rest there a moment as you breathe. And then bring your hands together in such ways the left hand rests in the palm of the right hand, and the right thumb comes around the side of the palm and rests in the palm of the left hand. It might come from the thumb side or the little finger side, whichever works best for you. And feeling now with the right thumb, see if you can find a hollow where the pad or the pillow of the right hand can just sit deeply in the palm of the left hand. This is the depth we're looking for, and this will be the primary focus of your attention as we proceed. And of course, if this doesn't feel so comfortable, you might switch the hands over and have the left thumb resting in the hollow of the right hand. Feel if that's better for you. And likewise, you could experiment with placing both hands a little further forward or back, a little left or right, finding out what's most comfortable and restful for your hands and arms and shoulders. Sensing for this just right place where the thumb finds a natural hollow to rest in the other hand. And at the same time, don't worry if you can't get it wrong, right? If you found a place that's comfortable, that is the place for now. Let your hands rest for now without pressing the thumb, just resting the thumb there, and begin to focus on the sensations in that place. There may be some light sense of pressure, there may be some warmth, coolness, or neutral temperature. There may be some slight sense of pulsing or tingling right there in the palm or the thumb. or some other sensation that's unique to you. Just notice and feel the sensations in this place as you rest the thumb in the palm of the other hand. Resting a little longer, allowing the breath to simply come and go, and sensing. Just some resting of the thumb in the depth of the palm of the other hand and feeling what you feel. Now, as you breathe in, very gently pressing the thumb into the palm of the hand for the full duration of the in-breath. Slowly, gradually increasing the pressure without having to press hard at all. Just a slow, continuous, gentle pressing of the thumb until you finish breathing in. And then allow for any pause in your breathing. And as you begin to breathe out, you also begin to slowly release and ease the pressure, the pressing of the thumb. So continue like this now, completely synchronizing this gentle pressing of the thumb into the palm of the other hand as you breathe in, and then gently, slowly releasing that pressure as the breath leaves the body. Continuing in this way, coordinating the pressing and the unpressing with the breath. Allowing for any little pauses in the in-breath, after the in-breath and before the out-breath, or after the out-breath and before the in-breath. Bringing all of your attention to the sensations in the palm of the hand. Feeling the change in sensation in the skin and in the tissues of the palm beneath the thumb as you press gently as you breathe in, and the change in those same tissues as you slowly reduce the pressure and breathe out. And staying with these sensations of pressing the thumb in the hand, pressing, releasing, and coordinating with the breath. Now, pausing a moment and noticing what you've done. Pausing the pressing and feeling the sensations in your hands, keeping your hands together and feeling for the sensations in your hands, in both hands, and in your whole body. And what's happening with the rhythm of breathing, the sensations of breathing. Resting like this now, with the thumb resting in the other palm and in awareness of the sensations in your hands and the breath coming and going. Noticing that thoughts in words or images or other sensations may arise. That's what the mind does, thinking, noticing, and just sitting and allowing the coming and going of thought, of other sensations. However, if your thoughts are racing or the content of your thinking is disturbing, you might return at any time to this practice of gently pressing the thumb into the palm with the in-breath, increasing the pressure as you breathe in and gently releasing as you breathe out. So in fact, I invite you now to return to this practice. And this time, find out if you can use even less pressure as you press the thumb on the in-breath and press with exactly half the pressure that you were using before. So you're breathing in, pressing in a synchronized way with the breath, but using only half the pressure. And staying with your attention on the sensation in the thumb and the palm. And then gently releasing this soft pressing as you breathe out. Unpressing as you breathe out. And continuing to do this practice with your attention in your hands, your attention on the sensations of pressing and unpressing, and coordinating very precisely with the breath. Using half the pressure, pressing very softly, beginning the pressing with the beginning of the in-breath, pausing at the end of the breath, and beginning the releasing of this gentle pressure with the beginning of the out-breath, ending with the end of the out-breath. And resting from the pressing again now, resting with the hands still touching in this way, and allowing the natural rhythm of the breath to continue, and feeling the sensations in your hands and in your whole body. These very small, gentle movements are inhibitory, and any calming effect may spread to the whole body, to your whole mood. Continuing pressing and unpressing with the breath. So this practice can be done during the day to help shift the nervous system, to shift you to a calmer, more gathered state, and also maybe used to help you get to sleep. For example, lying on your back with the elbows on the bed and the hands in the front on the torso, or lying on your side with the arms bent and the forearms and the hands together, and doing the pressing and unpressing with the breathing. And just to note that for some people, pressing with the out breath and unpressing with the in breath is a pattern that works better for you. So you might try this sometime and feel the results. Letting the breath come and go. Now very gently pressing the palm into the depth of the other palm, pressing the thumb into the depth of the other palm for the length of the in-breath, and gradually reducing the pressure as you breathe out, using this attention to help you calm and gather. Pressing gently for the full duration of the in-breath, noticing any pauses in the breathing, and gently releasing the pressing through the full duration of the out-breath. Allowing the breath to come and go. Good. So now slowly rotate the hands to allow them to separate. Slowly, slowly unmake the contact of the thumb with the depth of the other palm. Slowly rotate the hands and just simply let them separate. Resting your hands and arms on your thighs for a moment. Sensing yourself again. And then as you're ready, you might open your eyes if they closed and orient yourself to the room again. And even as you're aware of sitting in the room, sitting in this shared space online, just one more time, noticing the sensations in the hands, in the breathing, in the body. And this is the end of our practice today. Thank you all for coming. Be safe and take the best of care.